Second white coat. Subscribe and like. Let's learn medicine together.
We're diving deep into the neonatal intensive care unit, the NICU, where every single second is critical. And we're going to solve a life or death medical mystery that's unfolding inside the most fragile, complex organ you can imagine, the premature brain.
Okay, so here's the scene. Our patient is just 3 days old. 1 minute, she seems stable. The next, she's completely unresponsive. Her tiny body just limp. Her life is literally on the line, and the medical team is racing against the clock to figure out what is going on. So let's lay out the facts of the case. Our patient was born at just 30 weeks. That's really premature, and she has a very low birth weight. Now that alone puts her at an incredibly high risk for all sorts of complications, especially inside her delicate, still developing brain.
The team starts seeing a bunch of really alarming signs. She's lethargic, her body is limp, what doctors call hypotonic, and her cry, it's weak and high-pitched. But here's the biggest clue of all. The soft spots on her head, the fontanelles, they're tense and bulging out. All these signs are basically screaming one thing. There's a dangerous amount of pressure building up inside her skull. So, to solve this mystery, the team has to see inside the patient's head, and they need to do it right now. For a newborn, the quickest and safest way to do that is with a cranial ultrasound. It gives them a real-time window into the brain without any risk. And boom, this image is the big break in the case. You see these bright white areas right here? That's blood, and it is absolutely not supposed to be there. It's pooled deep inside the lateral ventricles, which are the brain's fluid-filled chambers. The diagnosis is suddenly crystal clear. It's an intraventricular hemorrhage, a brain bleed. Okay, so we know what happened, but that's only half the story. The real question is why? To really understand what's going on and to help our patient, we have to play detective and trace that blood all the way back to its source. So where did this bleed actually start? Our investigation now zeroes in on one primary suspect, a tiny, temporary structure that, get this, only exists in the premature brain. It's called the germinal matrix. So what is this thing? Well, you can think of the germinal matrix as a sort of nursery for the developing brain. It's packed with new cells and a really dense, fragile network of blood vessels. And its location, well, that's the key to this whole mystery. It sits right next to the lateral ventricles, exactly where we found all that blood. This diagram lays out the crime scene perfectly for us. See the germinal matrix here in orange? It's positioned right beside the lateral ventricle. So if a bleed starts in that fragile tissue, shown here in purple, it can easily just burst right through and spill directly into that ventricle. We're seeing the exact path the blood took. So why is this one little area so vulnerable? Well, there are 3 really big reasons. First, its blood vessels are just incredibly thin and immature, kind of like flimsy straws. Second, it doesn't have the strong supportive tissue that a mature brain has to hold everything in place. And third, a preemie's body just isn't very good at regulating blood pressure yet, so any sudden spike can literally blow out these delicate vessels. And here is the wildest part of the whole story. As a baby gets closer to full term, somewhere around 32 to 34 weeks, the germinal matrix just vanishes. It involutes. Its job is done. And that is precisely why this type of hemorrhage is almost exclusively a problem for premature infants. The culprit literally disappears with time. Now that we've found our culprit, we need to figure out just how bad the damage is. Doctors use a 4-grade system to classify these hemorrhages, and believe me, each grade means something very different for the baby's future. All right, let's start with grade I. This is the mildest form. The bleeding is small, and most importantly, it's stuck entirely inside the germinal matrix. It hasn't actually broken through into the ventricle yet. Now with grade 2, things have gotten a bit more serious. The bleed has ruptured into the ventricle, just like we saw in our patient's ultrasound, but the amount of blood is still pretty small. It's filling up less than half of that space. Grade 3 is where things get much more severe. The ventricle is now more than half full of blood, and all that extra volume causes it to swell up and expand, which starts to squish the vital brain tissue around it. And finally, we have grade 4. This is the worst-case scenario. The hemorrhage is so big that it has burst through the ventricle wall and is now bleeding directly into the brain tissue itself, what we call the parenchyma. This causes direct and often permanent damage to the brain. Now, to be absolutely sure we've got the right diagnosis, we have to do what any good detective would do: rule out the other suspects. We've got to make sure all the evidence points to one culprit and one culprit only. A common one you might think of is a subdural hematoma, but it's a completely different kind of injury. A subdural is a bleed on the surface of the brain, and it's usually caused by a traumatic delivery. Our patient's bleed is deep inside the ventricles. The location is all wrong, so we can cross that one off the list. And we can rule out the others pretty quickly too. An epidural hematoma, that's tied to a skull fracture, a venous sinus thrombosis, a clot, it just doesn't look like this. And a major artery rupture, super rare in babies. So you see every single piece of evidence, the prematurity, the blood being inside the ventricles, it all points back to our prime suspect.
And there you have it. Our medical mystery is solved. By following the clues, the baby's age, her symptoms, and that crucial ultrasound image, we've uncovered a story that's all about the profound and temporary vulnerability of the premature brain.
And this brings us to the single most important takeaway. The bottom line: if you have a premature baby with a brain bleed, the source is almost always the fragile germinal matrix. This is a foundational concept in neonatal medicine, and really understanding it is key to saving these tiny lives.
So let's just recap that diagnostic formula one more time. Step 1, you have a preterm infant, just a few days old. Step 2, they start showing signs of pressure in their head, like a bulging fontanelle. Step 3, an ultrasound confirms there's blood inside the ventricles. Step 4, the diagnosis, a germinal matrix hemorrhage. It's a classic but solvable clinical mystery. You know, knowing exactly where and why this bleeding happens isn't just some academic puzzle. It's the knowledge that drives real innovation in the NICU. Everything from better ways to manage blood pressure to developing brand new therapies. And it leaves us with a really critical question. How can we keep using this specific knowledge to better protect the most vulnerable little patients among us?